The next thing we would do is sort of what we call vestibular ocular motor screening. So we want to know, is the vestibular ocular reflex working, and is the sort of the control of that function causing any symptoms? So we're always assessing for symptoms when we're doing this. So we want to know, is it causing any nausea? Is it causing any dizziness? Is it causing any brain fog? And is it causing any headaches? So they're the 4 symptoms that we would score on, and we would say, you know, on a score of 0 to 10, do you have any of those symptoms now? And then as we go through each test, we would ask you again, you know, have you got any of those symptoms? Where would you score them? So we know, again, what's triggering the symptoms and therefore what exercises we need to prescribe. So there's a bedside way of doing this. So 2 lollipop sticks, clean ones I may add. I buy them from craft shops. I don't eat the Magnum off them. And we would look at sort of, do you have the symptoms? And then we would sit here and I would just come in front of you and ask you to keep your head still and follow with your eyes. So again, sort of about 30 degrees to the left, 30 degrees to the right, and bring it back to the middle. And again, do you have any symptoms having done that? And then we would do, so that would be your smooth pursuit. Then we would look at what's called saccadic eye movement. So I'd pop the 2 sticks up. Can you move just your eyes going between the 2 of them? And this one we would just go for a little bit longer. And again, we would ask you, do you have any symptoms doing that? No. And then we would want to go vertically. And again, we would ask you, do you have any headaches, dizziness, nausea, or fogginess? Doing
and
that
I imagine there's a little bit of science in distance from the patient and separation of the lolly sticks.
Yes, so you're looking about sort of, if you're thinking, if you're thinking sort of straight on, you're thinking about sort of a 30 degree. So if that was 0, 30 degrees that way, 30 degrees that way, or 30 degrees up, 30 degrees down, and at around about sort of 3 foot. Which, despite the fact I wasn't born when we had feet and inches, I still talk about 3 foot. But, you know, there you go. Then we would look at the one that's most likely to cause symptoms, which is your vestibular ocular reflex. So again, I would sort of hold that at a comfortable distance in front of you. And this is the one that I would actually set a metronome for you and get you to look at that. So I'm going to demonstrate it. So you would hold it out in front, keep your eyes on it, and then it's a very brisk turning of your head, keeping your eyes absolutely on the X. And then you would do it again vertically. Again, you would be asking, do you have any symptoms? Do you have any dizziness, headache, nausea, or fogginess after that one? And then the final one of that test would be your visual motion test, where for that one, I would actually ask you to stand up, pop your hands out in front of you, keep your hands out in front, thumbs pointing upwards, focus your eyes on your thumbs, and then I would just get you to swing side to side. Keep your eyes on your thumbs. And again, I would be asking you, do you have any dizziness? No. I'm going to stop there. Nausea, vomiting, or brain fog. Okay, so if you have a seat. So that would be sort of what we would call a clinical vestibular ocular motor screening test. And again, gives you a score because you may say, oh, you know, my headaches are 3 after that one. And we then, you know, we do the next one, and my headaches are now 7. It gives you an idea of where's causing the problem and therefore which exercises. Do you need to work on smooth pursuit? Do you need to work on saccades? Do you need to work on visual motion sensitivity? However, because I specialise in concussion, we go for the high-tech option in clinic. So we have something called the NeuroFlex headset. So this is a VR headset, and it can then look at those eye movements a little bit more objectively. So would you mind just slipping your glasses off, and I'm going to pop this over your head if I may. Just get that a nice tight fit. Does that feel fairly comfortable?
Yep.
The operative word being fairly. So I'm just going to calibrate it. You'll see a little dot come up. Just look at the dot as it goes around.
Is that what you're seeing, Susie?
I've got words saying look at the green dot and a green dot.
Lovely. It's just finishing off calibrating. So once the calibration's completed, we're going to look at smooth pursuit with the head fixed and smooth pursuit with the head free, because that gives us an idea whether it's purely concussion or whether there's a neck element.
Right.
And we're going to start that one. So we're going to start with the head free first. So as soon as we've got that calibrated, and the important thing is that if we're going head movement, we always make sure that it's in the middle to begin with. You still got that green dot there?
Yep.